Hi, I'm Dr. Brian Kaufman, a retired family doctor and a CLL patient myself, the Chief Medical Officer and the Executive Vice President and co-founder of the nonprofit CLL Society. And I'm going to present some of the important papers that came out of ASH 2021, the American Society of Hematology's annual meeting and exposition that was held in December 2021 in Atlanta, Georgia, and online virtually. And this is a paper that was presented by Dr. Anthony Maddow and other researchers. The title is Outcomes of Patients with Chronic Lymphocytic Leukemia Previously Treated with a Covalent BTK inhibitor and BCL2 inhibitor in the United States, a real-world database study. So covalent BTK inhibitors, and when we say covalent, we're talking about these irreversibly binding Bruton tyrosine kinase inhibitors, of which the two that are approved in CLL are ibrutinib and acalabrutinib. And when we're talking about B-cell lymphoma 2 inhibitors or BCL2 inhibitors, we're talking about venetoclax. These drugs have radically improved outcomes for patients with chronic lymphocytic leukemia. But although they're highly effective, they're not curative, and a significant portion of patients will require additional therapy. There are no prospective randomized clinical trials that have evaluated the efficacy of therapies following treatments with these two modern novel agents. So that's what this trial was set out to do. It evaluated treatment outcomes in patients with CLL who had had at least these two drug classes using a real-world data set from the US. To qualify for this, patients had to be diagnosed and followed with CLL between January of 2010 and October of 2019. They were required to have completed treatment with at least one BTKI that covalently bound, so ibrutinib or acalabrutinib, and more recently zanubrutinib, and the BCL2 inhibitor, which the only one that's approved in the US is venetoclax. And that had to be somewhere between their first, second, and third lines of therapy. Among those patients who went on to further treatment, the most common therapies included a venetoclax regime that was used in 31 patients, or almost half, 47.7%. Only 6.2%, or 4 patients, had therapy with a PI3 kinase inhibitor in this setting. Of the 65 patients who needed subsequent therapy, the median time from the start of the therapy after someone had failed those first two drugs, the BTKI and the BCL2, to discontinuation of the new therapy or death was a very disappointing 8.9 months. So what can we conclude from this? Patients with CLL who've been previously treated with a covalently binding BTK inhibitor and a BCL2 have poor outcomes as observed by time to treatment discontinuation of the subsequent therapy and overall survival. This represents a huge unmet and growing area of need for patients with CLL, and one that needs to be addressed, not just in this kind of retrospective data, which tells us that we're not doing so well, but in prospective studies that look for new options.